Hi everyone, welcome to our webinar today. My name is Dr. Julie Huang. I'm a naturopathic doctor and owner and co-founder of Aura Medicine and Wellness Clinic, and I'm super excited and grateful today to be able to introduce our dietitian at Aura, Rebecca Minshall. So she's here today to tell you all about designing your diet for mental health. Rebecca is a holistically minded dietitian who believes that food is the cornerstone of well-being and that it's complementary to life. It should not be overwhelming or restrictive. So by using mindful eating approaches, Rebecca focuses on what works best for each individual that she works with, and she recognizes that we're all unique. After obtaining her undergraduate degree in applied human nutrition at the University of Guelph, Rebecca completed over 1,400 hours of clinical placements and obtained her master's degree in nutrition communication at Ryerson University in Toronto. She has experience treating a wide range of health conditions and chronic illnesses, including diabetes type 1 and 2, gestational diabetes as well, obesity, weight loss, hypertension, hypercholesterolemia, eating disorders, and mental health. In addition, Rebecca has training in nutritional psychology, cognitive behavioral therapy, and meditation. She is passionate about mental health and well-being and loves sharing her knowledge to help others feel healthier and happier. Beyond dietetics, Rebecca is also a singer, songwriter, and musician and avid reader, and she loves connecting with others and is always open to new experiences. So I wanted to introduce Rebecca to you today. We're super grateful that she's going to talk about this topic, and I know a lot of folks have asked a lot of questions about this type of topic in our previous webinars. So this is the last of a series of 4 webinars that Rebecca has put on, and they're all free and available on our website at auramedicine.ca and on our blog, auramedicine.ca/blog. And so at any point in time, if you have a question, can't hear us, want to give us some feedback, do send a message in the chat, and we will make sure that we're monitoring the chat. And also, just so that you know, we are live on Facebook, so welcome everyone who's watching us on Facebook and interacting with us there. And we're also live on YouTube. So thanks so much, Rebecca. I'm going to pass it over to you. And yeah, I'm super excited for this talk. Okay, so we're going to unmute. Yeah, go for it.
Okay. Perfect. Thank you, Julie. Yes, I'm very happy to be here, and thank you for everybody who is taking the time out of their day to watch this webinar as well. So mental health is something that I am very passionate about, and yeah, so I'm looking forward to today as well. So, all right. So before we begin, just a quick disclosure. This webinar is intended for information purposes only. It doesn't take the place of individualized medical advice from a doctor, dietitian, or other medical care provider. I have no conflicts of interest and nor third-party endorsements. Okay, so today we'll be going through some of the statistics, so the numbers of mental health that is apparent today, as well as the basics of the brain-gut connection, which includes the microbiome. So a word that is kind of a hot topic today. I'll explain a bit more about what that even means. And then we'll be focusing more on depression and anxiety, since these are the mental health conditions that are the most prevalent in our society today. And so we'll be looking at some foods that have been shown to improve the symptoms of these conditions, as well as other considerations, which are maybe certain dietary patterns that sort of might hinder your progress in terms of the helping with these symptoms. So lastly, I'll go through some practical tips for actually beginning to design your diet for mental health, and then we'll have time for questions, answers. So like Julie said, if anybody has any questions throughout, feel free to put them in the chat, and then afterwards we'll have some time to kind of go through and hopefully just answer anything that might come up. So before I dive into it, I just want to clarify that designing your diet, so I don't necessarily I'm not really a dietitian, but in this context, it's more just a dietary pattern, meaning like looking at the overall you know, like what you're eating throughout the day. It's nothing like a weight loss diet or anything like that. So just to make that very clear. Okay. So one of the common statistics that I'm sure all of you have come across with mental health is 1 in 5. So essentially 1 in 5 North Americans will experience a mental health challenge in any given year. This is before COVID, so I'm kind of guessing that this year it's going to be even higher than this. But lo and behold, it's about 20% of people at any given time in a year will be experiencing something. So that's a huge, huge percentage of people. As well, almost half, so 46% of people will meet a diagnosis criteria for a mental health condition within their lifetime. So this means that the symptoms that are being experienced are severe enough to actually fall under a diagnosis. So food does play a role in this. So it's been shown that having a balanced diet can lead to more of an increased mental health, mental well-being. And on the other side, mental health issues are linked to poor dietary factors. So this is kind of like a two-way street. So it's not necessarily that like whether you're having these challenges, you will then eat poorly because maybe these make it more difficult, or is it because, you know, we haven't been eating so well, so that makes us more prone to the mental health challenges. So it goes in a two-way street, and it's not always something that's easily divisible, but basically we know that food does have an impact. So part of that is the brain-gut connection. So this is something that is pretty hot in like research and you know, online and everything, especially with the mental health. So I'll go through some of the basics of it. The reality is it's a really complicated system, and even in research, it's something that we are only beginning to kind of touch on because there's just so much, and research moves slowly, and we're just trying to figure out all of these little characters within it. So basically we have the enteric nervous system. So this is the nervous system that is in our gut. It has 100 to 500 million neurons, which are our nerve cells that send signals throughout our bodies. So this is the most neurons in any one part of our body, including our brain. So it has more nerves than our brain. And that's why it's been labeled as the second brain. So part of the system is the vagus nerve. So give me 1 second. Hopefully my face isn't covering on the side. But basically, if you see on the side, we have like a brain and then a link and then the stomach. So it's instead of a stomach, it's kind of like our entire intestinal, like entire digestive system. But think of the vagus nerve as being that arrow that's connecting the two. So it connects the brain with the gut. And it also wraps itself all around our digestive system. So it's all throughout it, getting different signals from our food. It also plays a role in food digestion. And we'll just send those signals to and from the brain to the gut. So very, very connected. The other parts of the nervous system that do play roles in the brain-gut connection include the central nervous system, so the CNS, which is the brain and the spinal cord. So it's kind of like the main thing we think of when we think of our nervous system. So it produces some hormones, including dopamine, serotonin, and acetylcholine, which play roles in mood regulation, our thoughts, and our emotions. We also have our autonomic nervous system, which has sympathetic and parasympathetic nervous system, so within the two. And that's like involuntary and voluntary functions, so things that we have control of and things that we don't so much have our own control. Our body kind of does it on its own. So these are also regulate some hormones, so adrenaline and noradrenaline, which have functions in our food digestion as well as fight or flight response, so part of like the stress response. And then lastly, we have the HPA-AXIS, which is the hypothalamus, the pituitary gland, and the adrenal gland. So these as well produce some hormones that stimulate the release of cortisol, which is kind of known as that stress hormone. Huge role in the stress response, fight or flight. As well, our gut plays a large role in this too. So what happens when any of those systems, if something is disrupted, so whether it's a chemical or just anything happens? So basically, if there is an imbalance in the nervous system or any of the signals, it can affect the entire brain-gut connection. So this can cause things like mood changes, reduced immunity, hard concentration, difficulty concentrating, and compromise our gut barriers, which is basically like this protective coating that determines what from our food that we eat or what's in our digestive system can actually pass into our blood. So as soon as that's compromised, certain things can get into our circulatory system and kind of that aren't supposed to be there and wreak havoc in different areas that should not have those different molecules. So when we think of mental health, one thing that I want to make sure is really, really clear is that medication can be extremely, extremely useful in some cases. So this webinar does not by any means take away from the importance of medication if you find something that works for you. And it's not saying that you should just automatically switch to food or even ever. Like it's all about the individual. So yes, food and our gut bacteria play a role in mental health, but when we're talking about medications, you want to make sure that you are under the supervision of like a doctor, somebody who is trained. And even if you are thinking of, weaning off of it, it is something that you want to make sure you have that professional overlooking. So today we are going to be focusing on the food. So part of that is this microbiome. So essentially, the microbiome is a word for all of the living organisms, the microbes in our guts. And we have very, very, very diverse microbiomes. So a person can have up to 1,000 different kinds of bacteria, microorganisms in their gut alone. So we have good kinds and maybe not so good kinds. So ideally, the ones that are more on the healthy, good bacteria have a symbiotic relationship. So this basically means that the guts do things in our bodies that help us, and we in return do something that helps them. So for a bacteria, we give them a home by having them in our guts. And on the flip side, they might be doing something like helping with hormones or breaking down fibers that we can't. So it's sort of just a mutually beneficial relationship that is ideal. So different roles that they play in making hormones. So these hormones can affect our mental health as well as inflammation, including brain inflammation, which has a link to some of the mental health conditions. So ideally, these are kept in balance, and disruptions then can affect all different parts of our bodies. So as we looked at in the previous slides, just because everything is so interconnected, different disruptions can actually show up in other places. And that's also part of the reason why having more of a holistic look on mental health. So rather than just thinking about the thoughts alone or, those obvious symptoms, it's kind of thinking that everything in our lives is connected. So as soon as one thing is a little bit off, we don't know how that's going to affect everything else. So having this bigger picture, including our diets, can be a great way to sort of begin to move in a more of a healthy, for our well-being, like that kind of direction. Okay, so within the microbiome, the brain has a role. So it's a two-way street again, because everything's a bit connected. So for example, 2 hours of stress can change our gut bacteria. So just that short period of time can cause different mechanisms in our body to actually change the bacteria that is in our gut. Our brains are also can be in charge of changing the movement of our gut, so digestion and absorption, and it secretes certain things like acid and base, which is really important for our body's pH and our mucus, so the protective layer for the gut. And that kind of goes back to the compromising the barrier. Is as soon as like any of this goes, we don't know like what might be floating around our blood that shouldn't be there. So food obviously has a role as well. So it can influence the brain directly and indirectly. So our food can be broken down by the microbes. So as I was saying, like sometimes they break down fiber for us, and that's something that we actually can't ourselves break down. And the food also can influence the brain chemicals, just depending on what we eat and kind of what's going on down there. And it also affects the gut bacteria. So certain foods can promote or slow down the growth of good bacteria. And there is links between, in the research, for food and many mental health conditions. So these include anxiety, depression, PTSD, ADHD, dementia, OCD, insomnia, bipolar, schizophrenia, and libido. So lots of research is coming out in these areas. And I'm sure more will come out in the next couple of years, just because it is such an important topic and something that is now catching the interest of not only the research community, but the mainstream. So it's good. Okay, so as I said before, we're going to focus today more on the two that are the most prevalent in our society right now, which are depression and anxiety. So anxiety is the most common mental health disorder. It affects up to 1 in 3 adults, and often it goes undiagnosed or untreated. So because we kind of think of being anxious, it's almost just normalized. So a lot of the time we might be feeling these things and do not seek help for whatever reason, but the research even shows, though, that only about half, so I think it's 50 to 60% of people who go for treatment for therapy and medication alone don't actually respond to it as well as would be expected. So this could be where it might be really useful to look at our diets. So there's a lot of links between anxiety, so anxious feelings, and our guts. So if you think about like butterflies in your stomach or being nervous before a big presentation and like your insides just turn to liquid. So there's obviously some connection between the two. Gut bacteria can be reduced and is less diverse in sometimes with people with anxiety. And this also won't change without changing our food choices. So the changes in our guts, we actually need to feed the right bacteria to be able to really kind of have a positive effect on that. As well, IBS is very common in people with anxiety. So IBS stands for irritable bowel syndrome, which is basically a condition that affects our, our digestive system, and our bowel habits can be, bloating and gas. So it's something that's not comfortable to have, but because it's so prevalent in people with anxiety, it kind of just furthers the fact that there is likely a link between like our anxiety and our digestive system. Depression as well, so it can have huge effects on our appetites. So kind of both ends of the scale. It can lower our appetites. It's just if we're don't have any energy or motivation, or we're just really feeling low, it can be hard to get that like the want to actually eat anything. And then on the other side, it can also increase our appetite, comfort eating, going for those foods that just make you kind of feel okay for a second. And part of this, it's always important to know that a lot of this has different mechanisms in our bodies that's beyond our control. So for example, when you're eating something like a comfort food, like something really sweet, and you just it might even make you feel guilty afterwards, or it's giving you like a spike of some of those good hormones, and you feel okay for a second, and then it goes away after a bit, and then you just want more. So it's there's a lot going on in our bodies beyond just our thoughts. So a lot of these cycles are beyond our control, and this is where having the help of somebody else can actually really kind of help you get a grasp on some of these things. So as well, just making healthy choices can be more challenging. Just again, the lack of motivation to actually make a meal might not be there. So those with depression, it's been found that it can change our microbiomes again. So it can lower some of those good bacterias and have higher levels of the not so good bacterias that can cause some of that inflammation. Okay. So we'll be looking at a few foods in detail and certain vitamins, minerals, something tryptophan, which again is another one of those words that is kind of out there, and as well as the Mediterranean dietary pattern. So all of these have had research shown that they can improve symptoms of depression and anxiety. Okay, so to begin, we have probiotics and fermented foods. So basically, probiotics is living bacteria that are good for our health that are actually found in foods. So you're eating these foods that already have the living bacteria in them, and they go into it. They get through our stomach, all that acid, and they can help our guts to repopulate certain strands that are seen to be beneficial. So they can increase the good bacteria, and these can be connected to mental health and memory, so a lot of the cognitive parts of things. They are available in supplementations. One of the things with supplements is that I personally always say like food first if possible. So because our guts are so diverse and we have so many different kinds of bacteria, you might be taking a probiotic and it very well has a beneficial bacteria, but that might not be what your body actually needs. So some of that can be a bit of trial and error. You know, you try something for a few weeks, see if there's any difference. If not, maybe switch it away. And so it's very, it's still kind of up and coming with the research. So it can be better to just try the food first. So that means introducing certain food sources that have these probiotics in them. So for example, there are probiotic yogurts, ideally with not so much of the added sugars, certain fermented soybean products, kimchi, kombucha, kefir, sauerkraut, certain cheeses like cheddar, Gouda, and mozzarella can also be sources of these good bacteria. On the other hand, we have prebiotics like fiber. So pre meaning before. So basically, these are foods that feed the good bacteria. So if you remember a few slides ago, I was saying how sometimes we have good relationships with these bacteria. So one of them is that the bacteria are actually able to break down certain foods like fiber that our bodies just aren't able to. So this can lead to decreased gut inflammation, blocking some cancerous growth cells, and growth and repair of healthy cells, as well as helping to maintain our weight because we'll just feel a bit more full. That's just tends to be how fiber feels in our body. It gives us that satiety feeling. So good food sources of the prebiotics include beans and legumes, oats, bananas, berries, garlic, onions, dandelion greens, asparagus, and leeks. So they're found in a lot of plant products because fiber is actually part of plants. So pretty much if you're eating anything that's like a vegetable, you know, plant or whatever, you're likely going to get a bit of these, the fiber and the prebiotics in it. Okay, and then we have omega-3s, which is another one of those that tends to be linked towards brain health, mental health, and it's considered an essential fat. So that means that we need to eat it in our diets because our bodies can't produce it. So it has roles in cell membrane structure and making hormones. So especially, you know, in our brain, the brain lipids, the omegas are really important for that. It can help to reduce brain inflammation, which again is linked to some of the mental health conditions and is just vital for mental health all around. So one thing that's important to keep in mind is to try and have a balance of the omega-6 to omega-3s. So basically our North American standard diet, we tend to have higher amounts of the omega-6 and not so much of the omega-3s. So if you look at the lists on the screen, The omega-6 is found in things like full fat cheeses, higher fat cuts of red meat, corn oil, palm oil. So these foods that tend to be widely available. So if you think about like fried foods, fast foods, a lot of them will have a lot of the omega-6s. Whereas omega-3 sources are things like the fatty fish, so salmon, mackerel, tuna, herring, sardines, walnuts, edamame, chia seeds, different vegetable oils, dark green vegetables, and certain fortified foods that basically the animal that's producing, eggs, milk, yogurt is fed food that contains omega-3. So it goes through its body, and the food that it's producing for us will have some of that in it. But it's ideal to have a ratio of 4 to 1. So basically 4 parts of omega-6 to 1 part omega-3, whatever that means for you. It's a lot easier to just think of trying to, add in some of these omega-3s to your diet, whether it's like having fish a couple times a week or like adding in some chia seeds or a little bit more rather than focusing too much on the numbers. All right, so vitamins and minerals, they're basically like the micronutrients, so the ones that we need just in small amounts, but are extremely important in our bodies for many functions. So making neurotransmitters, so those are the little messengers that kind of send brain signals all throughout our body, as well as our brain fats or lipids. Brain protection, immunity, regulating some of the chemicals, so the hormones that we talked about before, so all the ones that are related to, mental health, our mood, our thoughts, our stress. They can play a great role in all of those. So research has also shown that in some cases, adding a multivitamin can actually help or may reduce anxiety. So again, it's trying to go the food first way, but sometimes just having that multivitamin can just be that little foundation that just kind of gives us a little bit of those things that we might not always be getting from our diet. So that could be something to consider if you don't think that eating these foods will be enough. But again, that's something that maybe speaking to somebody trained in nutrition like myself or another dietitian could be a good way to start. Okay, so foods that improve. So B vitamins. So we have B9, folate, and B12. So these two, their functions are actually interconnected. So basically, if you are deficient in one, you're going to be deficient in the other, just because of how they work in our bodies. So deficiency can contribute to loss of brain cells, especially in the hippocampus, which is important for learning and memory. So this can also affect our stress response and our serotonin synthesis. So basically like, certain things that are connected with anxiety and our mood, happiness and all of that well-being. So there's also the link to depression, and increasing your B9 or folate intake can also sometimes help with depression too. So some food sources of these, again, the legumes, citrus fruits, banana, avocado, leafy greens, certain vegetables like asparagus, nuts, seeds, fish, and shellfish, all will give you some of those, the B9 and the B12. So two other of the B vitamins to keep in mind for mental health are B1 and B6. So these help to make our neurotransmitters, and they're involved in our mood, and anxiety can help to reduce that as well. So food sources, same as B6 and 12, as well as soybeans and whole grains. Okay, then we have vitamin A. So this helps our brains and neuron function, so our brain cells and those messengers as well. And deficiency can affect how we respond to stress. And increasing your vitamin A has also been linked to improving depression. So vitamin A is found in things like a lot of the orange vegetables and the dark greens, so sweet potatoes, carrots, spinach, and then black-eyed peas as well. And then we also have vitamin C, so it helps to make neurotransmitters and has a potential link to depression as well. So a lot of the citrus fruits, vitamin C, you always think of oranges, orange juice, cantaloupe, strawberries, some of the cruciferous vegetables, so broccoli, cauliflower, Brussels sprouts. All of those are decent sources of vitamin C. And lastly is vitamin D. So there's been research that shows that those with depression and anxiety can have actually lower blood levels of vitamin D. So it may help to increase your vitamin D to help with anxiety. So it can be linked to decreasing inflammation and is important for our nerve health and stress response. So most of our vitamin D ideally will come from the sun. So 80% is the stat that they have, and that's direct sun exposure. So if you're sitting in the sun, but it's through a window, it doesn't actually convert to our skin because the UVB lights that do that on our skin are blocked by the glass. Really important though to note is that if you're anywhere right now, being in Canada where winter is 6 months of the year, to get that sun exposure all year long is really challenging. So this is again where maybe a supplement might be something to consider. Because the food sources, yes, vitamin D is fortified in things like a lot of cow's milk, egg yolk, salmon, sun-dried mushrooms, cod liver oil. But again, it might be a good idea to just have a little baseline of a supplement if you aren't exposed to the sun regularly. Okay, and then we have some minerals. So iron, again, protects our neurons, helps make the mood chemicals, so those hormones that are linked to our happiness and thoughts and feelings. Some food sources: shellfish, lean red meats, organ meats, legumes, pumpkin seeds, broccoli, and dark chocolate. So one thing to note is that iron, when it's from an animal product, is better absorbed in our body than the plant-based ones. So, and that's just the way that our bodies interact with it. So if you're having more of the plant-based iron, it's best to have it with a source of vitamin C because they help each other be absorbed better. Zinc as well can reduce the brain inflammation. So seafood, lean beef, poultry, beans, nuts, whole grains all have sources of zinc. As well, potassium and selenium have shown that they might be able to improve mood as well. So sweet potatoes, banana, mushrooms, oranges, peas, cucumbers, Brazil nuts, all of these have bits of those minerals in them. And lastly, magnesium. So it's one of the most important minerals in our proper brain functions and muscle relaxation. So as in our Western diet, which I'll talk about just what that means very soon, we tend to have lower levels of magnesium, and deficiencies have been connected to anxiety and depression. So magnesium can be found in things like avocado, almond, spinach, black beans, nuts, seeds, legumes, whole grains, and certain omega-3 sources as well. Okay, so we have tryptophan. So tryptophan is one, like I was saying, that's kind of been showcased in the mental health and all of that. So basically, tryptophan is an essential amino acid and a precursor for serotonin. So just like omega-3, being essential means that we need to eat it because our bodies can't make it directly. So it's the one that's kind of claimed to be like, because after Thanksgiving, you're just sleepy after eating turkey. So that's the amino acid that is linked to that. One thing just to note about amino acids, so what that means is that basically amino acids are the building blocks of protein. So we have a bunch of different ones and they kind of rearrange themselves depending on the different proteins. And so tryptophan is just one of those. What the research shows about tryptophan, though, is that supplementation of purified tryptophan can increase the brain's serotonin. So this means that if you're taking a supplement that is only tryptophan, there is a chance that it can increase the brain's serotonin. However, food sources of tryptophan do not necessarily increase the brain's serotonin, unless there's some studies that show like if you eat twice what the RDA is, then you might see a bit of that impact. But the reason for this is because, as I was just saying before, there's many different amino acids, and tryptophan is one of the least common ones, and it's also one of the lower priorities. So other amino acids, when we eat them like in a protein like source, we'll get a bunch of them, and they all kind of hang out around our brain, and usually the brain will take the other ones and leave the tryptophan kind of in our blood, so it doesn't actually reach the brain. But one thing that's been shown is that eating a food higher in tryptophan with a carbohydrate can help to make the tryptophan more available to our brain. So an example of this would be like chickpeas. They have some tryptophan in them, and then a carb, which would be like maybe whole grain crackers or pita, or else, turkey and mashed potatoes like Thanksgiving. And part of this, the science behind it, is that carbohydrates, when we eat them, they our digestive system, we start to produce insulin in our blood, which will then also take some of the other proteins and bring them to other places like our muscles, instead of just all kind of hanging out in the blood. So that can kind of make tryptophan a little bit more available to actually have those effects, including increasing serotonin in our brains. So, okay. And then lastly, we have some dietary patterns. So the Mediterranean eating pattern is one that's kind of been researched, and one of them is the MODI-Med, so it's like modified Mediterranean. There's a study, it's called SMILES study, which basically stands for supporting modification of lifestyle and lower emotional states. So they did a study that had people eat more of a Mediterranean-based diet and compared it to a control group that would have just been eating whatever normal diet. And so this has been shown to improve depression compared to control groups. And part of what this is, it has higher amounts of vegetables, grains, and legumes, moderate amounts of fish, fruit, nuts, seeds, unsweetened dairy, and olive oil, and lower amounts of animal products, sweets, fried food, and refined grains. So basically, if you look at the ones that are higher, so vegetables, grains, legumes, fruits, fish, nuts, seeds, all these things are the ones that in the previous parts of the webinar are the ones that kind of have all of these other nutrients in them. So up to 2 glasses of red wine as well. Okay. So just some other considerations. So there are certain dietary patterns that actually can kind of hinder our mental health. So one of them being the standard American diet, and its acronym is SAD. So if that's not, foreshadowing what's to come, then I don't know. But yeah, so it's basically, if you think of like a fast food meal, like that's kind of what this dietary pattern has. So it's kind of higher in the refined carbs and lower in the not so healthy carbs, fats. Lower in the good carbs and higher in the not so healthy fats. So there are links to depression and anxiety for people who eat more on this dietary pattern. And it can also increase our risks of developing other chronic illnesses such as diabetes, obesity, and heart disease. Obesity in itself has actually been linked to higher levels of anxiety and changes in our gut bacteria. So just something to keep in mind there. So sugar and refined carbs. Basically, our body does need glucose, which is a form of sugar, especially our brain, to give it energy. But when we're eating a lot of sugar at once or throughout it, we can kind of flood our brain with that glucose, and this can cause inflammation. So it's better to eat sugar and refined carbs in moderation and pair it with like a protein or a fat source just to get a bit more balance there. Fried foods and not so healthy fats. So these are things like saturated fats, trans fats, and higher intakes are linked to higher risks of developing depression and poorer well-being. So it's again better to eat these fried foods or the not so healthy fats in moderation. Avoid trans fats if possible. There is a ban right now. However, it still's on the, there's a time frame of when these fats have to actually be out of products. So just something to keep your eyes out. But within the next few years, they will be not allowed to be sold at all. So eating more of the healthier fats like olive oil, nuts, nut butter, seeds, avocados, and moderate amounts of some of the other fats like corn, sunflower, and safflower oils is a better way to kind of begin to change that balance. Caffeine, so above 400 milligrams a day has been shown to increase anxiety. So that's about 4 cups of coffee. It overstimulates the brain's threat areas and slows down the areas that regulate stress. So we're kind of like going crazy over here. And then what would normally help to balance is being slowed down. So it's just not really helping with that stress management balance, which makes sense if you've ever experienced kind of drinking too much coffee, you kind of can get jittery. So that's all part of that. And it's not necessarily helpful for those who are experiencing anxiety. So you can consider just cutting down slowly, ideally, just to avoid any caffeine withdrawals. You can choose decaf or mix like half decaf, half regular. And then also choosing things like herbal teas. So chamomile especially has been linked to more of its calming effects, which can be helpful for anxiety. And lastly, alcohol. So it is a depressant. Though it has like the short-term benefits of like relaxation, basically its after effects can lead to stress, anxiety, poor sleep. So these things that lead to more of like the long-term not good symptoms. So you can consider just completely avoiding alcohol or trying to drink in moderation. Okay. So this last little bit, I'm just going to go through some tips to begin to use some of what we just went through to incorporate it into your everyday life. So these are some tips for designing your diet for mental health. So starting small. So I always tell my clients that small everyday changes lead to long-term sustainable change. So a lot of the times when we kind of want to make changes in our health, we want to just like totally have this whole makeover and like overnight and just be like, yeah, now I'm healthy. But the reality is that huge changes like that, you might be able to sustain it for like a short period of time, but long term it's not necessarily going to be lasting. So having those very small changes every couple weeks, like just slowly working towards a bigger goal, is actually a much more manageable, realistic, and sustainable way to approach certain changes. So with the foods, it's actually a better idea to just begin to add in some of the foods that we spoke about. So rather than restricting, the higher sugar and like the not so good fats, it's easier to just add in some of the better ones. So this could be, trying to have a serving of vegetables each day, beginning to choose whole grains over some of those like more processed, refined white grains. Choosing baked foods instead of deep fried. So like a baked potato instead of French fries. And then just trying to have like maybe add in a serving of the healthy fats each day. So that could be like a handful of nuts or whatever kind of small steps seem reasonable to you. One thing that I do with all of my clients is begin to incorporate parts of intuitive eating approaches. So this is kind of like learning to listen to your body and like learning what foods work well with you, very much trial and error, and like noticing, if I eat this thing, like, do I feel more energized or do I actually just like feel awful, and kind of just it's investigation and small steps. As well, choosing water. So water above pretty much any other beverage is usually the best choice, especially the ones with a lot of the added sugar. So juice, pop, just kind of, or even just beginning to drink more water, because dehydration is linked to anxiety as well. And lastly, if not the most important thing, is to just try and find your support team. So be it friends, families, different health professionals. I work with a lot of clients who are seeing me as well as like their therapist, their doctor, their naturopath. So really just having those individuals that have your best interest in mind can be such an advantage when you're trying to make these changes. And then even just having them to check in, because the reality is, especially when we're dealing with additional mental health conditions, changing our patterns and behaviors is hard enough. So the reality is it's going to be like up and down, good days, bad days, and just having that team who has your best interest in mind can really help to especially get through some of the harder times and motivate you to continue just looking at the bigger picture rather than getting bogged down of like, little things, everyday things, or whatever might be going on. So definitely one thing to begin to kind of, investigate is just who is there that can help you through whatever you might need. Okay, so I will be emailing everybody who is attending this webinar a free handout, which kind of goes through what we talked about today. And you'll also get my email. So anybody who has any questions beyond what might be answered today, feel free to pop me them through my email, which is listed here. It'll be on the handout and I'll email you. So rminshall@oromedicine.ca. And I would be happy to answer any short questions or potentially speak further. So yeah, there's all the references.
Thanks so much, Rebecca. That was a really great and informative talk. We have a number of questions that came in. I think this is a good time to ask the question and answer. If folks need to get going or they have questions that aren't answered today, they can always book a 15-minute consult with Rebecca. And the advantage of that is that they can speak a little more personally, and you can and Rebecca is going to be able to give you a sense of what she can and can't answer. She can't really provide medical advice in a general setting or dietetics advice, but for patients, she could answer, more specifically around, what the practice is like and what our approach is like. So I just wanted to kick it off. We have a number of questions here, but really I wanted to know personally, why are we talking about this? So why are we talking about diet and mental health, and why is it important to you?
Yeah, so for me, when I actually did my internship for nutrition, I knew that I wanted to sort of specialize in more of the mental health and eating disorders and all of that. So personally, I know from my own experience, from those of my loved ones, from patients, is that mental health it's very holistic in the sense that like it's not just what you're thinking, and it's all these other things that play a role. And without mental health or like well-being, it can really hinder our enjoyment of the rest of our lives, because that tends to be just how we see our lives. And if we're feeling like not the best, like it impacts our entire perception and enjoyment of all that is around us. And when I was going through school, actually, I don't think I learned anything in my undergrad that was related to mental health. And so it was kind of throughout my own experiences and studying that I really began to be interested in this, and then also like picking up information and, keeping up with the research and all that. So.
Yeah, that's great. I mean, I find this topic super helpful and relevant to my practice too, because a lot of folks that we work with in naturopathic medicine, we work a lot with people, the whole person. So the mind-body connection is really important. Thanks for sharing. So you mentioned at some point intuitive eating, and I just wanted to know sort of how that integrates into how you use that in your practice. I know it's a very specific kind of dietetics approach. Can you tell us a little bit more about that, and I guess that your practice?
Mm-hmm. Yeah. So I borrow a lot of the concepts from intuitive eating in my approach with clients. So part of that being, like I was mentioning, learning to listen to your body and like learning where your hunger signals come from. And parts of that is just like creating a structure of food to like turn on these signals again, because we kind of can move away from them, especially if we're living busy lives. And so with the mental health piece as well, it can be very empowering to begin to understand yourself, and it's all linked together. And this approach as well, it doesn't have any real restriction. It's more just like, okay, like let's just enjoy food, see what our bodies actually want, because a lot of the times it is the healthier foods, and just you know, rewire certain beliefs that we have as well. So it all kind of like comes together in the mental health, just because it is a very nice way to approach it and very individualized too.
Okay, great. I love that. So we have a couple of questions too from the group. So one question I'll read to you is, you mentioned about brain-gut connection and how this impacts us, how we feel, how we digest, but how important do you think it is, how important do you think breathing is?
Ooh, that's a good one.
I have some
Yeah.
thoughts about that too. Yeah.
Yeah. Okay. It'd be interesting you said. So I have training in meditation as well. So I think that like that is something that is of the importance, right? So it's looking at things as that holistic approach again. So we have our food, we have our like exercise, body movement, breathing, you know, that can, just because our brains and our bodies are so connected, just having that, you know, if you can get into more of a calm space breathing, then that it's I don't think it's necessarily like one is better than the other, but they definitely both have a lot of benefits to being able to kind of get into a better mental well-being. I don't know if I
Yeah, I think that's I mean, definitely it works that way too. And what comes to mind for me is the polyvagal response, and the idea that when we do deep breathing, the diaphragmatic contraction can actually activate the polyvagal response, which is the vagus nerve. That is part of the parasympathetic nervous system, so that rest and digest process. So you're getting more digestive enzyme production, better activation of the gastrin, and then thus the stomach acid production. So then you're actually getting a better, more, you know, also a better MMC, or motor motility complex. That's better peristalsis, that's better digestion. And then activating that nervous system, you get better blood flow, better nutrient absorption because of the blood flow too, and activation of the enteric nervous system. So it really ties into exactly what you're saying, and breathing can kind of do that from an active standpoint. And that's probably your experience in meditation too, is that idea that it's like a physical thing we can do to get our bodies out of the conditioning.
Mm-hmm.
That's great. So there's another question that I sent you that someone else wrote here. There's so many questions here. So I don't know if we're going to get to all the questions. So if we don't, well, Rebecca is going to email everyone out the handout, a recording here. And then also, if you have personal questions, just feel free to book a 15-minute consult. They're free, and it's a great time to ask your questions. So let's see. There's a question about sugar. So when you mentioned that too much sugar can flood the brain and cause inflammation, the question is, which sort of inflammation is this? Can you give an example?
So basically that was specific to brain inflammation. So inflamed brain has been, brain inflammation has been linked to depression and different mental health conditions. So that's what I spoke about with that. I don't know if that answers the question, or should I be more specific?
I'm not sure. Maybe the person who asked the question can message us and let us know if that answers the question. But I think that makes sense. And also you can, talk about it more on an individualized basis, because inflammation markers are generalized even in the blood work when we check it. So it depends on the presentation for that particular person always. Yeah, what about this question? So we have a question about TRP. You mentioned TRP in relation to RDA. And the question is really, what is RDA?
Oh, yeah. So,
and then this follow-up here is, isn't it better just eating good fat instead of other fat?
Okay. So two things here. So RDA is the recommended daily allowance. So that's basically the amount that has been shown to be enough for the vast majority of people.
Mm.
every day to get what you need. So for tryptophan specifically, it's 5 milligrams per kilogram per day. So basically whatever that equals to, depending on how much you weigh. Yeah. And the research that has shown that like the diet interventions that can help is twice that. So basically like 10 milligrams per kilogram per day. So that's what that means. That is kind of like the recommended amount. But in terms of mental health, it's kind of like you have to do twice that.
Mm-hmm.
So was this connected to the next question about?
I don't think so.
Fats?
I think
oh,
it was
okay.
a separate question.
Okay. Yeah, so that's what that means. And again, it's just, so like a lot of the research with the food sources is not necessarily showing that they get to the brain. So that's what I was kind of talking about with that. So I think looking at the overall dietary pattern, so just trying to get a variety of food is really the first step, is just kind of like, and that's what I work with people, is just looking at the overall pattern and then like, okay, from here, how can we begin to improve that? So that might kind of have to do with the good fats, bad fats. Is that, what was that question? Sorry.
Well,
oh, okay.
Yeah, it depends
Hopefully
on that. Yeah, I sent you the question. Yeah, so, but I mean, just on what you were saying, like about RDA and tryptophan, I think I think folks, we want to emphasize that like you are simplifying a little bit, because I know, like we're leaving a lot of things out right now. Like we're leaving out the conversation about intermediaries, about the biochemistry of like getting from tryptophan to serotonin, that process involving 5-HTP production, the nutrients and neurotransmitters, like for the cofactors of that metabolic pathway. So there's like a lot of things that you're kind of like, I know you're just trying to make it more accessible right now. So we're just not going to, I think it's better not to go too far into it. But yeah, that's the context of the amino acids. And I think that's a really good answer. I guess the other question is about fats. So like which fats are good to eat? Isn't it better just, so what would you classify as, I guess, good fats?
Okay. So good fats would be more of like the like monounsaturated, polyunsaturated. So a lot of the ones that are liquid at room temperature, or found in certain foods like avocados. So the ones that aren't so much of the processed or the saturated, the trans fats. So the ones that have gone through either it's the processing to make them more solid, or just how they are. So really the easiest way to think about any of this is going more for those healthier, the plant-based fat sources, the oils, and then only having, or trying to have like the more of the like fried foods, the saturated fats in moderation. So it's not even necessarily that you have to avoid them completely. It's more just like, okay, let's just focus more on getting the good ones and slowly kind of eat these, enjoy them when you're eating them. Like these foods taste good, but it's the balance of things.
So the good fats being the plant-based fats in their raw forms. I mean, I think the emphasis that you had mentioned, monounsaturated fatty acids, those are the best, because there is obviously a ton of research on fats and how they oxidize when they're cooked and things like that. So I'm sure you could go on a whole nother 2 talks on fats. But I hope that answers the question that this participant was asking. And if not, hopefully you can reach out and have a whole conversation about fats. So thank you for asking that and for answering it. And then there's one last question, I think, that we'll have to wrap up. Are you aware of any research specifically looking at the link between mental health and IBS? I've noticed it a lot in my own practice, and I think mental health should be part of first-line treatment advice for IBS.
I agree with that. I think mental health and dietary interventions should really be foremost in a lot of the treatment and any kind of condition, IBS specifically. So there's been the research between, as I mentioned with the anxiety, so 60% of those who have anxiety have symptoms of IBS. So I do completely agree with that. And just all the research that is linking these two things, And especially IBS, there's a lot of stuff that says that like when you have your triggers, it also can trigger your anxiety. So kind of, and then vice versa. So it's kind of like they work with each other just to, you know, positively make them worse. So definitely considering a patient's mental health, anxiety levels, stress is something that I think should be at least asked about, spoken about when going in for treatment. And then whether at that point it's like, okay, let's, you know, bring in other interdisciplinary staff members, maybe like, you know, therapy, those kinds of things. So very much I agree that mental health should be considered, if not for any kind of treatment coming in or symptom sign, chronic illness. So
yeah, I think that's a great question and a great point. Like, we see so much in the connection between stress and IBS, and that you describe it's almost like a cycle. Like you get triggered, and then it's hard to kind of get out of the cycle. And I'm sure this participant probably knows a lot about this topic, so it'd be really fun to hear a bit more and even, you know, get a bit more specific on IBS. What I like about IBS and like all the questions it brings up is because it's a syndrome, right? So it's not that like pinned down diagnosis. It's just this collection of symptoms. And it can be, and it's well known to be categorized with or characterized by folks having anxiety as well. So would be super cool to, if, I mean, I agree to bring it frontline treatment. So yeah, I mean, there are tons of questions here. I want to give you the chance to, you know, reply to them. I just want to tell everyone that I posted the link in case you wanted to book a 15-minute consult to ask your questions further with Rebecca. I posted it in the chat, so all participants should be able to see that. We'll also send it out in the email when Rebecca sends out a summary of this talk. We'll try to record it and put it up as quickly as we can. And if not, just, you know, in the meantime, just feel free to email if you have questions as well. I'll also include Rebecca's email in the chat. And so that's time's up for us, but thank you so much for the amazing presentation, really informative. And thanks everyone for coming and asking all your awesome questions. I hope it was great for you. I mean, for me, I'm like overwhelmed with all the questions I have now. So yeah, I just want to say big thanks to Rebecca.
Yes, thank you, Julie, and thank you everybody who came. So definitely do not be shy with any questions, or feel free to email me, book that 15 minutes. I'd be happy to talk more. So thank you, everybody.
Okay, cheers. Okay. Bye.